cool.
All the game ball here.
Look at that, all I had to say was the magic words.
Yeah. Exactly. Hello. Nothing. Good evening.
Yeah.
Rooster?
Yeah. Rooster vision. I told everyone we're waiting for a form, so.
Okay, thank you everyone for coming. I will call the meeting to order at 5:02, and I would ask that we stand and join me in the pledge of allegiance, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay. First up on the agenda will be public comment. Does anyone here that would like to speak to the mask issue? Do so at this time. Please state your name and the town that you come for the minute. Okay, who would like to go first? Dr. Buffet.
6 days ago, we were here. Not everybody who's here now was here then, but most of you were. We agreed at that point to continue masks in our schools for the time being and reevaluated at the end of March. Nothing substantive has changed in that time, and my recommendation that would be premature to do so was based on a number of factors which continue. Grafton County and Sullivan, I just heard again on the drive-in, are still in high transmission for COVID, and therefore the new guidance from the CDC for mask optional in communities, and mask not recommended inside in communities, doesn't apply. There are about 45 to 66% of people that we know are vaccinated in the 5 towns of this district. Nowhere near what is needed for immunity. Nobody knows how many additional people may have some immunity from infection, and nobody knows how long and how strong that immunity may last, may be. There are 6% of ICU beds and 8.1% of hospital beds available in our area, which includes the Upper Valley and down along the Connecticut to the southern border, so that they can have enough numbers to be able to compare. Local control, which we exhibited last week, is just empty words if it's overridden by central higher authorities. Given no real choice, as I know you don't, by the Secretary of Education and the governor's nuclear edicts, innuendo intended, I realize that you don't have any choice but to rescind our recommendations for last week, but we're doing so on the basis of metrics that are manufactured and do not exist. And I can't see, despite that, that it is worth threatening the legal and funding complications that would occur by defining this order from the secretary. Sorry. Bye.
Thank you, Dr. Buffet. Yes.
Hi, my name is Sarah Boas. I am from the town of Enfield, and I'm also the school nurse at IRS. I have to disagree with Dr. Buffet. I feel like a lot has changed in the last 6 days. The governor has lifted what was considered a mandatory mask mandate, or the district were able to decide that for themselves. That has been decided by the governor, as well as, for me, from the beginning of this pandemic, I've been on the front line, just like the other nurses in this district and our administrators. And our answer back to the people that always gave us backlash about what decisions were made by this board and by the Department of New Hampshire, the health department, was this is what's recommended by the Department of Health. This is what our board has chosen to follow. This is why we're doing it. What has changed? Why is this board in our district not following those guidelines anymore? My question is, yes, I know the CDC has something totally different as far as their guidelines, as far as transmission in the community. I looked at the numbers too today. 10 people in our 5 areas that we deal with, Enfield, Canaan, and the rest of the district, 10 people have tested positive over the last week. So you know what, that's compared to how many a few weeks ago? So yes, a lot has changed. I know the CDC is recommending something different as far as high transmission areas. We've never followed the CDC guidelines. There's been a lot that has been different between the CDC and the New Hampshire Department of Health along this route that this path that we've taken. We've always gone with what New Hampshire has told us. Now we're going to change all of a sudden? I have a real problem with that, being I'm one of the ones on the front line trying to explain to families where our philosophy is coming from. If I cannot use the guidance that I've been given, I can't do my job. That's my feeling. I think masks should be optional. It should be up to families to decide what they want to do with their children, to put masks on their face, just like any other adult or any adult that works in this building or district-wide. I get the updates from the New Hampshire Department of Health. The last one I got, I'm going to read it to you. It states, it was pandemic update number 57. As the Omicron surge declines, population immunity increases, effective therapeutics, are increasingly available, and there is decreasing risk from COVID-19, the New Hampshire Division of Public Health Services is no longer recommending universal face masking, but rather, recommends that decisions on face masks are based on individual choice and informed decision by the own risk assessment of each individual. So if we're no longer following what the Department of Health recommends, what path are we following? Thank you very much.
Thank you. Anyone else in public comment?
My name is Brian Elstein from Canaan. I'd also like to speak for the mask optional policy that should be implemented in accordance with the recent changes from the State Department of Health. No offense, but you're not my doctor. I don't consult with you for healthcare decisions, and I think everyone should hold that personally and make their decisions. Like was just stated, the State Department of Health has removed any leg that you had to stand on to require masks. You are now opening the district up to legal action should you not remove the mask mandates. I personally would like to pursue that should the board not vote down the current masking policy that's in place. I came here several months ago and spoke against masking at that time before the recent Delta and Omicron surge, highlighting the risks of psychological trauma that the American Academy of Pediatrics had placed on students. We're doing a disservice to our children and to each other as adults I truly believe that the kids aren't learning how to interact with each other well because they're not able to have the read of the facial expression. So much of our communication is nonverbal and through body language. Talking about CDC, personally, I've never been one to trust or follow what the CDC is saying, but it's my understanding that if not now, in the near future, they're removing the requirements for school districts busing to require mask mandates, even though it is still required on public transportation. School buses would, my understanding, would go to a local option, whatever the district is. And furthermore, I look at some of the negativity and how people are treating each other. If someone feels that they have a condition or their thought is to wear a mask, then by all means they should do that, but should not lump everyone else into the same group. Over the course of this pandemic, I've heard of teachers that have come in and told their classes that anyone that doesn't wear a mask is personally responsible for the death of people. Who does that as someone that's molding minds? Why do people have this animosity towards each other? We have a CEO of a local hospital that months ago made comments about not treating people, and I understand triage if there's resources, but to flat out say that you wouldn't treat people and to have local town managers reiterate that point, that they would not treat people that did not get vaccines. As a medical provider, I don't see how you make that jump in your humanity. Do you say that you're not going to treat cancer patients because they smoke, or cardiac patients because they weren't eating a vegan diet? Where does that end if you want to head down that road? And I think a little more care and compassion and humanity should come back to each other, and quit trying to say, have a mindset of this person's dangerous to me or this person's a threat. And I think getting the mask off would go a long way towards people being more civil and having a little more shared humanity with each other. Again, I think that the board has no ground to stand on, given that the state has removed any recommendation through the Department of Health and through the governor's office, and the governor's office said they would be working with the Department of Education to work with districts that would not repeal mask mandates. So I think at this time it would be smart for the Mascoma district to remove that and not open the district up to any legal action for not removing the mask mandates. Thank you.
Thank you, Ryan. Do I have anyone else for public comment here? Do I have any through Zoom?
Well, there's somebody there, but it says anonymous,
Nope.
and we
Sorry.
have names for minutes.
I need names.
The anonymous person would like to sign out and sign back in and use their name. Does that work?
We have to have names.
Okay. Other than that, that's it.
Okay. Then the discussion will continue. Okay. So on the recommendations for the use of masks in school, Amanda, is this the attachment on here? Is that part of what you're going to discuss now, or is it you going to start off with something different?
So you do have in your packet the technical advisory.
Yes.
That was in the electronic packet as well. That comes directly from the Department of Education. And it does allude to, I think Dr. Beauvais started, that it alludes to Ed 30604, sections A6, where you are out of compliance in providing the education to students, or fair and adequate education to students. So that is where the district would be opened up to potential lawsuits should you continue with a mandatory masking. But I really think Rob and I at the previous board meeting had shown you some data. We had shown you some graphs, the downward trend. We had shown you the other schools that had already been moving to masking optional. You will also know that last week we reported 8 cases of COVID across all schools in the SAU. So that's another positive downward trend. The week of 2/7 through 2/11, we had seen 27 cases. So down from 27 to 8, and we did have a week of vacation in there also. I do know that some of those cases reported on the week of the 21st were positive cases over vacation. So those had been reported there. So I really think it is now on to the board. Cookie, I'm happy to answer any questions. Rob's happy to answer any questions that we could possibly, you would like to ask us specifically, but we have provided you with that technical advisory from the Department of Ed. I think that is very important to note. And I do think it now is up to the board to look at what you would like to do moving forward.
I'd like to open it up to the board. I'd like to hear the opinions of the other board members in regards to this. If there are any questions for Amanda and for Rob.
Do you need a motion before discussion?
That's totally up to you. If you'd like to put a motion on the floor, absolutely.
I'll put a motion on the floor that the district no longer recommend universal use of face masks in the school setting.
Second, that motion.
Wait, that you said what? I'm sorry. That the school district will no longer what?
Use universal face masking in the district.
Okay, I'll send it then.
Thank you, Tim. Okay, discussion. Anything else? You want to start off, Kevin?
Basically, I don't see where, as a board, we have a choice. Legally, we're bound to follow the guidelines that were presented in the technical advisory that we received. And in doing so, it still leaves a venue for people that want to have optional masking. And I think that that's probably the only way that we can assure everyone is feeling comfortable. There shouldn't be any repercussions for someone wearing a mask. The other issue is the busing. And even though Butler is a contracted service of the school, they're still considered a school setting. And the CDC guidelines changed on February 25th, and they no longer mandate that masking be included in public transport or school district transport.
So I thought that was a Department of Transportation thing, so we'll have to find out the specifics of it.
Yes.
That reference.
Oh, cool, all right, no, I was just under
But
the
the
impression,
specific,
look at that, you got it.
Yeah, I looked it up as well.
Okay,
CDC guidelines changed as of the 25th.
okay.
For busing is in
Cool.
schools.
And we did receive some letters that weren't correct in referencing the CDC. They were outdated.
Awesome.
with the point of,
They were referring to the January 25th mandate for busing and masks on busing.
school buses that are under the federal motor carrier mandate, they're not under the CDC. Federal motor, and you go right to the federal motor carrier's website, and it will state that school buses must comply with masks at this time.
But there's conflicting information on that document.
Federal
So,
motor carriers.
Again, I think it falls back on our shoulders as a board to decide whether or not we're going to support masking on the bus.
What does the state of New Hampshire say?
The state of New Hampshire sent out an email to superintendents today linking to that CDC reference, stating that buses, I'm assuming what Kathleen gave you is the CDC. I don't need one, Kathleen. I'm just assuming that that's, before I assume too much, that's the CDC's guidance on mandatory masking on buses. And effective February 25th, the CDC does not require wearing of masks on buses or vans operated by private or public school systems, including early care and education/childcare programs. I will let the board know that a lot of school districts left the mandatory masking in place if they removed, or if they moved to optional masking before the 25th. So I imagine that those school districts may have to go and revisit it. I do understand that buses fall under, Rob, what am I looking at?
The Transportation Security Administration, the TSA, still mandates mask wearing on all forms of public transportation. That being said, they also have a link to the CDC mask order, which says you don't. So mixed message, but as far as the TSA is concerned, masks are still required on buses and other public transport.
You can't put kids 6 feet apart on a school bus.
Yeah.
You can barely have them 2 feet apart. Trust me, I know.
My understanding is that the Department of Transportation one, TSA one was bound to expire, I think, in 3 weeks.
March 16th?
Yeah, coming up in 3 weeks or so. So I wouldn't be surprised if they just pulled it because it was so soon. But if the state is pointing us to that, then okay.
One of my concerns is that they don't have anything on any websites about any of this, as far as the recommendations. Like when you go to the New Hampshire DHS, there's not even a press release. You go to the DOE, there's nothing on their, website regarding any of this. In terms of lifting the mask mandate, I would think we need to have a little bit of time to, kind of hammer out some of these inconsistencies and maybe get a little bit more commitment from the DOE in terms of how exactly these inconsistencies might play out. The other thing is we still, I know that NHSBA didn't necessarily say that, as far as the legal liability, we aren't necessarily under that curtain that they're threatening us with. But we also do have ADA requirements in terms of accommodating people with disabilities in 504 plans in the classrooms, that, there could be potentially immunocompromised teachers, immunocompromised students that would need to potentially have additional accommodations other than them simply personally wearing a mask. And I would think that maybe it would be helpful to the schools or to the, the classrooms and the students and the teachers, the teachers and the nurses, to give them some sort of at least segue into this mask, the new reality of not wearing masks. So to kind of, I think that we might need to look at making an effective date, not tomorrow, maybe in a week, or, to give a little bit of time for the dust to settle and work out some of these other issues like buses, and how it might look. So, because right here, I'm hearing that there's some inconsistencies. It makes me uncomfortable that they haven't even bothered to update their website. Parents can't even look on it for parents that want to have masks, and there's a lot of parents there. There's going to be uncomfortable. We've heard a lot about people who don't want to wear them, but the people who want to wear them, they're a little bit not so vocal. They need some reassurance too, and they might need to be directed to websites. The other thing that I'm really concerned about is that we can't expect our teachers to police this in the classroom. So and also that there's not reverse mask shaming. So I think that the teachers and the administration would need some time to talk about, being inclusive and how to be kind, on the other side of the spectrum. If so-and-so needs to wear a mask, you don't know why. So just to give a little bit of time to get all of these things worked out in the classroom. So I also think, like I said, it'd be difficult for the teachers to have to, they can't be in the position of saying, put your mask on. Those are just some of my concerns. And I'm hearing inconsistencies, and I don't think we have everything ironed out to say no mask tomorrow. So if we potentially might need to amend this motion to make it in a week, that would be a thought I had, so.
Danielle?
So, I mean, I'd say that our staff are already in that position of having to say, put your mask on. I mean, I hear it from students, I hear it from staff, they're already having to do that. And so moving to mask optional would actually alleviate some of that additional stress that you have in the hallways and the classrooms and the cafeterias and all those sorts of things, from what I can tell. We know that the numbers of cases have decreased because a lot of people are doing at-home tests and are not reporting that. That's part of the reason why the CDC moved to differentiate their map, their colored map, to also look more at hospitalizations, knowing that that's a more consistent way to be able to track some of those things, because if you're in the hospital, you're in the hospital and you're a number, and that's not necessarily the case for positive cases. As Dr. Buffet mentioned, Grafton and Sullivan County are still in the substantial region. I think that has a lot to do with the fact that we have the residential college towns in Grafton County, as well as the tertiary care hospital. And so I think that does have an impact on that. The CDC update for the busing is there, and I understand that there's some of those inconsistencies of being able to share that information in both places. But I really think that we are in the position that we need to move to mask optional. We do have KN95 and KN94s and N95 masks available to staff. If there are families that are in need of those, have we secured enough supply that if there is a family that wanted to send their student because of health reasons, they'd be able to access them through the school?
We still have masks available.
Okay, so that is
Probably
something.
1,500 to 1,200 to 1,500 and 95 masks available.
So we have those available to families and staff that are looking for an additional level of protection. You know, we're starting to get warmer weather, the windows are gonna start opening again, we'll have the additional ventilation. And I also asked around to some of my colleagues at Dartmouth Hitchcock, and including some of the people that you see quoted in the news articles all the time, and they are actually for mask optional at this point as well. So with that being said, there are still some cases where masks are going to be important, and that will be for anyone who has symptoms, anyone who has the exposure, and anyone who's a positive case. Those essentially are the, and if you're feeling that you're at additional risk from being immunocompromised. But I'm comfortable in moving forward with mask optional as of now, and not for additional, with the knowledge of additional guidance may come regarding busing. If we need to just focus on opening it up for in the school, because the question with applicability of who makes the rules for buses, if we need to hold on buses, I'm okay with that, but I think that within our school buildings, we're at the point where we need to move on to mask optional for the sake of all of our families and staff, and they can make the decision that is going to be best for them based on those, as we continue throughout this pandemic, that Swiss cheese model of mitigation strategies. Open windows, masking if you need to, and good hand hygiene. We'll continue to do that. But at this point, I think with the state guidance, with the CDC guidance, and from local guidance, I think it's time for us to move into that group of mask optional.
Thank you, Danielle.
You know, I'm mostly disappointed in the state Because a couple weeks ago, the governor said, oh, we trust our local leaders to do what's right for what's in their districts. Well, that's a whole bunch of crap, because then he goes and 2 weeks later says, nope, you have no choice, you have to remove these mandates, and then threatens the hint of legal action. I would have much rather had said, if they said, you have 2 weeks, make your plans, let's get out of this, let's work together, but instead it came down as a top-down edict. That concerns me over local control, because anyone who feels the importance of, democracy in action, and, it's often said that, town meeting in New Hampshire is the closest we have to democracy, like true democracy, but if we can't make decisions at the local level for ourselves, then what good is it, So that being said, I think it's disappointing that the state chose to do it this way. I would have much rather they do it that way. As far as, masking, I understand we're between a rock and a hard place. We really have no choice. I understand we're still going to continue a lot of the other mitigation factors, like, this keeping desks as far apart is reasonable. Like, I understand at the middle school, they're still eating their lunches in their classrooms, right? See, I would have much rather had kids have masks and be able to mingle and go to have their lockers and go to have lunch with everybody. And the one thing that they would have is masks, but no. So, and because that's a more normal experience for a kid, in my opinion. I asked my kids, do you mind a mask? That a lot of teenagers are fine with masks, because you know how many faces teenagers make. So, no, not mine, but yeah, we're pretty much between a rock and a hard place, and that's that.
Okay. So we have a motion on the table. I will concur with Tim that I agree that we're put in a very tough situation. I feel like we have done a superb job in this district for 2 years, protecting our kids, protecting our staff, and helping as a whole to protect the community. I would like that to be clearly stated. And to yank that from out from underneath us and tell us now we don't have a say, it's not right.
Okay, I just want to add that I think we need to turn the thinking around a little bit, because the board is not saying you cannot wear a mask.
Yeah.
Correct.
We're a small group of a few people here, and according to what information we've been given by the government, we have to follow the policy as it is presented to us. But now the ownership is on individuals and parents, and if they're comfortable with their child wearing a mask, then that can continue. It isn't going to stop just like a light switch has been turned off. So I trust that parents will do the right thing for their child, and I think that most of the community will continue. The other part is the risk could very well increase, but we can't control it.
Yeah.
We're doing the best we can as a school board.
We're still gonna be here as a district to be able to support the families one way or the other.
Yes.
Whatever the situation may arise, I want them to be confident that they can come to us and we will do the best we can to help. Like I said, I just wish that we were able to do what we had felt as discussed at our last board meeting, what we were looking to do by the 22nd of March. So,
But also in reference to our last board meeting, we did not have a motion on the floor. We just had a consensus of the four of us that were here, including yourself.
correct.
And so we didn't have this information. It came out the next day.
Yeah.
And again, there wasn't any crystal balls. That's why we're here tonight.
Yeah.
And, we have to deal with the business at hand.
So this was the soonest we could meet. I want to make that clear. This is the soonest we could meet, given the time of notices that have to be posted and the time that the governor made this announcement. So it's not like we could have met last week on this. So
Yeah.
I just wanted to be clear on that.
Yeah.
I did have another, do you have anything else? I didn't want to Did we ever talk to the teachers union?
So-
What is their feeling on masking for staff and such?
So the numbers, the last numbers that had been shared with me, and I don't suppose Megan Prince is on. She was going to try to attend tonight.
Do not see her.
Ellen Wilbur, I don't want to
Ellen's
speak.
here.
Can Ellen speak? I mean, I'm happy to give the numbers as I know them. Ellen, do you have the most current numbers from the survey?
Yeah, just let me bring it up.
One thing I'll chime in about the timing, it seems as if the governor or any of those offices only thought about those that had vacation for
Yep.
this week.
Yep, I noticed that too.
That would
Yeah.
allow
That's
for
true.
that
Yeah.
time period that Hope you mentioned and kind of getting everything together so that everything adds up correctly.
And
So
another
they're-
nod to where the state is centered.
Right, right.
Okay,
Knowing
here
that
the question was, do you think masks should be optional for everyone in the Mascoma School District? 57.7% of the teachers that took the survey said yes. 42.3 said no. And the second question, if the school board chooses optional for students, would you be in favor of mandating masks for staff? 75.2% said no, 24.8% said yes.
All right, cool. I'm glad we have those numbers.
I have
No.
one more question. Is there, if we, go with mask optional, first of all, I'm gonna go back to the part that I actually don't, I think that NHSBA stated that we still do have local control, regardless of what the state has come down and said. And there were 4 cases in the Superior Court that said the board's authority is at the local level. So there is even some debate in that area. So knowing that is a gray area, is there a part where we would, as a board or administration and teachers, if the numbers are trending up, do we want to, set some sort of parameter in terms of when we might need to put masks back on? Because we do know masks are probably one of the most effective part of not transmitting this virus.
That's true, but as it
Just not sure
stands,
that's true with N95s.
I'm sorry.
I'm sorry.
As it stands, we could not say masks back on. Even if there was a huge uptick and swing, because as it stands, this is saying we're in violation of education rules. If at all, any point, we say, doesn't matter if every kid in the whole classroom has COVID. Can't do it.
In this Ed 306 rule, we're violating it because,
Because if we would mandate a mask.
see, that's why I went to the website to look and I didn't see.
Because, well, their reasoning is saying that it would no longer promote a school environment that is conducted to learning. So, that's what I'm not saying it's.
So I would go back, Hope, to the first part of your concern, and that I think if DHHS, so if you had a school nurse and a principal have an outbreak, we had a cluster in a classroom, upon the advice of DHHS, that would override the lack of a mandate. So we would be able to require masking in those situations, but we would need the backing and the support of DHHS in order to do that.
Okay,
So there is a way to
All right.
at
that's
least
good to
protect us
know.
that way.
On that note, I will say we have never had a cluster in our district, right? To my knowledge, not in a classroom.
Not in a classroom.
Not in a classroom, teams, that's a different thing, but, we never had a cluster in a district. We've had, other districts that have been mask optional, been cluster after cluster after cluster, and classroom after classroom, and classroom after classroom. I'm proud we're not that district. We haven't lost a single teacher, no one.
What about other mitigation strategies? Are we only here to talk about masking tonight?
That's it,
Yes.
just masking. Hopefully that is not gonna be a problem too, but the masking is the one for discussion tonight.
We could,
I would like to see them be local control at the building level. They know what's best. For the other strategies.
But unfortunately, we are in the position to make that decision tonight.
We can put signs on the front of the doors that say masking recommended, masking strongly suggested.
Brewster?
Yeah, is anybody checked with Butler bus number 1? That's the first question I got. And as you know, or if you don't know, I'm still recovering from a positive COVID test that I've gotten over a week ago, and I'm still not recovered yet. So that's, the mask optional, it's on the table, but I've never been on the school board where I've been put in a corner and threatened to be sued. So I plan on not being sued, and I don't think we should be threatened with that, irregardless what we make for decisions all the time, because that's not favorable to us. I didn't come on this board to do that, to be threatened by the public for being sued on, especially on this count here. So that's what I got for my, 10 cents.
Thank you, Brewster.
Get better, Brewster.
So a motion on the table is to mask lock, how did you want to word it?
Hold on a minute. Looking, up here.
Yeah.
I think you said
To
remove
repeal
universal masking.
universal face masking in the district and school setting. Yes.
And we had Kathleen and Tim.
Effective
I second it.
tomorrow?
Okay.
Do we need to put an
Yes.
effective date?
What are you gonna do? What are you gonna do about the bus?
We can't do anything right now.
We can make a motion afterwards to authorize Amanda to change it if, there's clear guidance from somebody, from, DOT or TSA or somebody. I don't know. Or we can keep it until our next board meeting.
I keep it.
Call the bus.
I'm not, I'm happy, thank you, Tim, I appreciate
I don't-
that.
yeah.
I do appreciate your trust there. But at this point, I think there's too much of a conflict between, I don't like that, what was it, TSA, Rob?
TSA.
Links you
CDC.
back to the CDC. Or we could leave it to, if it expires on March 16th and it expires on March 16th, you could
Mhm.
authorize me to remove it on March 16th if you so chose.
You have to do nothing before then.
And the board would be able to do that because we reorganized on the 15th.
Oh, yeah.
You could authorize me this evening to do it if it expand, if it,
In between now and,
If it's rescinded.
if it's
Yeah.
rescinded, expires, whatever terminology they used.
so the mask on the bus would stand at this point.
If that's what the board chooses to do.
I don't think that's an intention of the motion.
No, it's not. So it would have to be amended to state that because that's a critical point.
Yeah.
It's a very critical point.
And maybe say in district buildings.
No, I wouldn't amend my motion to do any guidance over the bus, because in my opinion, the bus is an extension of a school setting, and Butler Bus Services cannot tell the school what to do. They're contracted, so they need to follow our rules, like we have our policies in place about behavior on buses, and this would fall under that same guideline. Now, I'm not a lawyer, so I'm not saying it's written in stone or anything, but that's something we might want to check out while we're waiting. But as for right now, if my motion stands, then individuals can use their own feeling about riding the bus with a mask or without a mask. I don't see how we can cross into that territory tonight, because we don't know what Butler's bus service is going to respond, how they're going to respond to our motion.
Because it's very well, if we said take them off, then they'll point to the federal guideline and say, no, we have to keep them on.
The FSA has different guidelines, because that's public transportation, but
Yeah.
schools fall under another category, a subcategory of public transportation.
Point of information, was busing warned?
Hold on.
Was that Dr. Buffet?
Was busing warned on your agenda?
No, it's just the masking for the school district itself. But there was concern there with that, because if they're not gonna wear them in school, then, you know, they're gonna get on the bus without one as well, even though they should have them on.
Well, the technical advisory says school settings. So that's the real question.
Correct.
If the CDC also says it's considered a school setting, school system, then it seems to me you're covered. But I'm not a lawyer. I wish the lawyer was here tonight, truthfully. But
Well, the motion on the floor is to cover this school setting at this point, so I think we need to address some, and any, Brewster?
Don't you have the phone number to Butler Bus, some representative you can get a hold of right now to clarify this with the bus situation? Don't you have somebody in contact right now on the phone and find out if we're gonna do this masking with the buses? Because we're talking about two things here now. Now you're talking to the schools, or you're talking, and also the buses. So if you're putting them both together, then you need to get hold of Butler Bus right now, and before you vote on this thing, and get this clarified.
I think it's a point of order. The motion says in specifically school settings.
That's
And,
not a school setting. The bus is not a school setting.
well, I disagree with you. I think it is. We
I don't
have
think
policies that govern behavior on buses. That's because it's a school setting.
Well, then you're doing that with sports, then. You're doing it everything.
That's true. School settings, yeah.
But no, that's a broad range. I don't agree with that.
Brewster, we're gonna deal with the motion that's on the floor at this point in time. After this motion has been voted on, I would then probably look to see if maybe the superintendent could have a conversation with the bus company to see exactly where we stand with that. If further action is needed, we will have to take it back up on the 15th when we reorganize. We don't have any other choice at this point in time, not unless I call an emergency meeting before next Tuesday. And that may be the case if there's pushback in regards to the buses. I don't know what else to say. I know what I was told as a driver today, and that doesn't seem to be the consensus here.
so what were you told today?
Federal motor carriers, buses are under the federal motor carrier mandate for a mask, and we were told that all students must still have a mask on. That's just,
And then we
What
have
else?
this that says it's a school setting.
Mhm.
So, okay. Well,
See,
this is
because of the
why
close
we
proximity,
need time.
because the close proximity in the buses, just because they're sitting on top of each other, you know, I'm okay leaving it on there right now until further guidance comes out. The DOT's expires on the 16th. There's clarification, DOT pulls it back before that, you know.
that was
but-
the TSA.
TSA,
The
I'm sorry, TSA. So, because it's unclear, I mean, yes, this is it from the CDC, but then TSA says something different, the federal motor carriers. So,
Well, the CDC says wear masks, and then New Hampshire says don't, so.
and we're left to deal with it.
The CDC doesn't say to wear a mask on that paper.
No.
Oh,
I mean,
So,
Well,
this isn't bad, I meant.
is there any further discussion on the motion that's on the floor? Brewster,
Just,
you're muted.
I'm trying to unmute it. Here we go. Reread the motion again, please, as it's been brought up.
All right, hold on, Kamala's gonna get
Go
it.
back, hang on. To repeal the mandatory universal use of face masks in a school setting.
Did you hear that? Oh, okay,
Yeah, I did.
okay. Is there anything further? I will do a roll call vote on the motion. Hope strike now.
Oh, boy. Um, Yes, sure.
That was an affirmative yes.
That was an affirmative.
Kathleen Stacy? Yes. Danielle Thompson?
Yes.
Tim Josephson?
Yes.
Bruce to go.
You muted.
Unmute.
We can't hear you.
Did both times, yes, yes. Well, sorry, man. It says unmute and unmute, you know?
Ellen Cookie Hebert is a yes, so 1, 2, 3, 4, 5, 6 to the affirmative. So the motion carries. And that would be effective tomorrow.
Can I just review with the board, is this an appropriate time, Cookie, of the parameters around which that this would happen?
Yes.
So in the letter, I've taken some notes here. I want to make sure that the public knows that we will have masks available, the N95 masks available to anyone that would need them. We would also have paper masks available to anyone that would need them. That there may be a time where that students may need to go back to a targeted and temporary use of masking. For an example, if we had a cluster in a classroom or other cohort, the administrator, the school nurse in collaboration with DHHS would then go through and determine that that cohort would need to mask for a certain amount of time. If there was if someone was interacting with a staff or student with specific needs as outlined perhaps in a 504 or in an IEP, that those persons should need to be masked. If we had any staff listed with HR that would be vulnerable, medically compromised or vulnerable in some manner, those students in that classroom may need to be masked also. Good, I'm getting it right?
No, excuse me, I don't
Oh, sure.
think you can legally do that for the classroom. The individual that has the condition can wear a mask, but you can't mandate that the classroom wear a mask.
I can take it out. I mean, I think you can, I think I could say it.
You can for
If it's-
ADA recommendations for allergies. So I don't agree with that.
Check on legal counsel on that, because I
Yeah,
don't
okay.
think.
Yeah.
I mean, if we can for a peanut allergy and
Right.
for, it's an ADA,
Mhm.
America with Disabilities, so,
Yeah, and I'll go back to, yes, ADA, I'll use ADA in it. And the 504 is developed by 504 or special education needs an IEP.
I can tell you from personal experience, the ADA recommendation is that the individual gets removed to a safer setting.
Okay,
they get an accommodation, an
Yes.
appropriate accommodation,
yep, okay.
and
I can,
which
I'll word it very,
facilitates their education.
yeah, appropriate accommodations will be made for staff then.
Right.
Is perhaps the way to
Yeah,
go.
that's a good way.
And masks will still be worn on the buses until further notice. And masking, I'm not sure we brought this up, but obviously masking will be worn on students and staff returning on day 6 after they have tested positive for COVID. If they're unable to do that, they need to isolate for the full 10 days.
Yes.
Can we also include a note that reminders about if you're not feeling well or if your student is symptomatic, please keep them at home.
Yes, my typical
Yes.
cut and paste from my letter.
And I would also like to just, reiterate, there'll be no, zero tolerance for any shaming of other
Yeah.
kids with masks or teachers and stuff.
I expect to see 30 to 50% of our kids
I do
still
too.
wearing masks.
Oh, I do too. I do.
So
Yeah.
we will make sure that those are triaged
Yeah.
But
very effectively.
I checked in with everybody today at the schools, with the exception of the high school. And across the board, I heard that if teachers cannot, if little Johnny's told to wear a mask and then he takes it off, that really has to be like Dino said, it needs to be maybe potentially something's communicated to the parents, but it really is an issue between the parents and the kids in terms of
Right,
keeping
yes,
it
we're
on.
not gonna put teachers in a position of a checklist of
Right.
Yes,
who is supposed to wear a mask in your classroom.
I
and who
heard
isn't.
that across the board
Yeah,
today.
for sure.
Yeah, and because I've heard of other schools doing that, like we want to know which kid wants something now, like that's way too complicated for our teachers to
Yeah,
have
And that
to do.
will interfere with education.
Yes.
Yeah.
Okay,
One more thing, I just want to thank Dr. Buffet for all of his feedback and all of his guidance on this. You've been a long trusted medical source in this community, and I just want to say thank you for everything you get. All my choices have been made on your medical information, your guidance. You know, they're not political, it's not personal, it's based on science and fact that you've given us. So thank you, Dr. Buffet.
thank you.
Well, I think what we've seen, depending on the various interpretations of a glass half full, glass half empty, I hope that the current ends up with good results, and that I'm wrong, but we'll have to see over time.
I would love for you to be wrong.
Is there anything else from the board?
The other comment that I'd like to make is that we have heard from community members about this, and I do appreciate those of you that have taken the time to either come to meetings or to reach out to us by email. We hope that you'll continue to stay engaged with what's going on in the schools and with your students, and that we hear from you about things that you're happy with, as well as things that you wish might change.
Thank you. Anyone else? Was there anything before I open it up to public comment?
No, I'm pretty well set on this. I ran the gamut all basketball season and I got caught up in it a week ago or so I'm getting better, but it's I'll tell you what, you get this thing, you don't want it, even though if you're vaccinated and boosted. So I was. So all right, that's it. As I said, I'm good with everybody else's whatever they had to do, but so
Thank
anyway,
you. I feel better.
hopefully I'll be able to meet with you guys on Wednesday for the finance meeting. So,
Okay,
all right.
Let me
I'll
know.
try.
okay, yeah, thank you. All right, public comment. Do I have anyone that would like to speak at this time? There's no one here. Do we have anyone on Zoom? Oh, Stephanie. Hi, Stephanie.
Hi, I don't know if you can hear me or not. Bob is the anonymous person. Sorry, I'm not all that computer savvy every day. I just wanted to say, like Sarah, I think that we do have to follow the mandate that we have been given, but I wanted to make sure that it is included that when kids have to follow isolation and quarantine, that they will need to wear a mask. And I was about to write Amanda to make sure that was included in the letter. And that was really what I wanted to make sure that they knew, that there may be a time when a mask will be required. And thank you very much.
Thank you, Stephanie. And do we have anyone else, Camilla? Okay. All right. Do we have any non-public tonight?
We do not. It does say be hiring. I don't have anyone to present you for hiring.
Okay,
All right, then.
all right.
No motion on that.
I want to thank everyone for coming tonight, and for everyone on Zoom, and for everyone that came out tonight in the audience as well. Hopefully this will settle down and we can get to the matter of hand of educating kids and coming into spring, and hopefully we'll have a good run, so.
And don't forget to vote.
That's right,
On Tuesday.
March 8th. Don't forget
Candidates
to
night.
vote.
Candidates night is
Candidates
tomorrow,
night
right?
Tomorrow.
At the Enfield Community Building.
That's right. All right, well, I appreciate it, and the meeting is adjourned at 6 PM.
All right. Kids out in the car.
Did you crack the window?
Crack a window, yeah.
I did right now. They had drama until 5.
They're big things.